I'm Daniel St. Louis from Grenada. Recently completed the Emergency Medicine Masters in Guyana. And I'm back here now to serve.
Daniel is a graduate of our emergency medicine residency program and went back to Grenada, where he is the first emergency medicine trained physician in Grenada.
When he returned back to Grenada, he wasn't practicing with ultrasound despite having trained with it. So that gave us the opportunity to travel down to Grenada. It's a small island in the South Caribbean, only about 100,000 people. We're super thrilled to be able to help him get an ultrasound machine.
Somehow the different shades of gray, kind of fascinated me. Initially I didn't understand a thing. You looked at it and it was all just gray or black. And then bit by bit, things started making sense. I just came to love it. But I realized it is a useful tool that can easily assist in patient care.
It was fun to teach him and to see how he really took to it and just right away had this sort of enthusiasm and interest in it.
Ultrasound is particularly useful, even more so than in our day-to-day practice here in resource-limited settings, and can give you a whole host of information in taking care of those patients at the bedside.
Ultrasound is relatively cheap, it's accessible, and it's pretty easy to teach someone how to begin to use it. And not only that, but with use, they get better.
The times I miss ultrasound the most are with our trauma patients. The fact that we're so far away from the main tertiary hospital, it means that we have to take very difficult decisions. Do we keep these patients? Do we discharge them? Do we transfer them?
Physicians in the A&E like Dr. St. Louis have some tough decisions to make. They need to first decide what's going on with the patient, how stable is the patient, and then they need to decide, is this something that I can manage here at Princess Alice Hospital, or do I need to transfer this patient to the tertiary hospital in the capital, St. George's? Making a very quick diagnosis with ultrasound helps Dr. St. Louis know how to begin his resuscitation and knowing that these patients need to be transferred right away.
I thought it fascinating that you could carry a little machine around the place and without worrying anybody else, you can easily find out what's going on with your patient in a very quick space of time. Pregnant women, very big application. Spotting, pain, positive pregnancy test. Is there blood in the belly? Is she ruptured? Is the pregnancy intrauterine or not? And fascinatingly, ultrasound gives you the ability to just in a split moment answer all those important questions for yourself.
2 ruptured ectopic pregnancies per month here at Princess Alice Hospital. That's 2 young moms whose lives are at stake with a critical diagnosis. Putting a diagnostic tool in their hands that helps them make that diagnosis is going to be really, really important.
Our goal is to equip physicians with the equipment and the knowledge to use in their clinical care from day to day at the bedside.
We simplify techniques so that physicians know exactly where to look and what they're looking for. So they're not just scanning through the whole body, just hoping to find something wrong. They know right where to look.
The education is key, because if they're not receiving that education, they're not really going to learn how to appropriately use ultrasound in the care of their patients.
It's one thing to have access to the technology, but it's a whole other thing to have access to the technology and to know how to use it appropriately. This is very much a clinically focused entity. We're not interested in a comprehensive anatomical survey. We're asking, for the most part, focused clinical questions of our patients that we have in front of us, using ultrasound as a diagnostic tool to answer those questions and then moving forward.
We had a great time at Princess Alice Hospital. The physicians were hungry for knowledge, passionate about improving the care that they provide their patients. They see the importance of ultrasound. They see that ultrasound is going to improve how they're caring for their patients, and they're hungry for the knowledge and skills to do that.
Now that I have an ultrasound machine, I don't have to call a tech out. I don't have to worry the medical director. I don't have to call a consultant or something. Right there, by the bedside, in the A&E, I put the probe on and I know what's going on with my patient. I buy a lot of time. I love that about it.